Well, good afternoon. My friends, I know many Ontarians are thinking about their plans for the holidays. I know there are many families who are looking forward to their traditions and special celebrations, whether it's lighting the menorah or a visit from Santa. And after the year we've had, it's important that we find some time over the holidays, but we have to do it safely. I know that families are starting to make their plans, so it's important that our health officials provide advice. The Chief Medical Officer of Health and the Public Health Measures Table have provided detailed guidance on how to stay safe and healthy this holiday season. I encourage everyone to review this guidance as you make your plans for the holidays, because this year is unlike any other. We are in the second wave of COVID-19, and we can't take any chances. We have to bend the curve and stop the spread of this awful virus. And each of us has a role to play. The safest way for any of us to enjoy the holidays, no matter where we live in the province, is to celebrate with our own households. Doing so is critical if you live in a lockdown region. If you live alone, you can join one other household, so you won't be alone for the holidays. Please don't have big holiday parties, don't have large gatherings. Most importantly, follow the guidelines for your region as outlined in the province's COVID-19 framework. They're clear, they're easy to understand, and they're online for everyone to learn more. And folks, we know this is really difficult time for our small businesses. That's why we're investing $600 million to help small businesses in red or locked down zones. We will cover your fixed costs. We're covering property taxes, gas bills, and hydro bills. We worked with the federal government to provide support for up to 95% of your rent and up to 65% of your payroll cost. It's why we're providing grants up to $1,000 to help small businesses cover the cost of PPE. And it's why we're investing $57 million in the digital Main Street program to help more businesses build their online presence and reach more customers. We're doing everything we can to support our small businesses, but the most important thing of all for all of us to do is to support small businesses this holiday season. Shop local, shop early. I know it's easy going to big box stores or ordering from the big online retailers like Amazon, but whatever you need to buy, there's probably a small business in your neighborhood that sells it. So buy it from them, especially during the Christmas time. We should try to give back to small businesses who's given us so much back to our communities. Buy from your local toy store. Stop by your local bakery. Order takeout. Believe me, folks, it makes a world of difference to those mom and pop shops. Let's spread a little more joy this season, take care of each other, and make sure we stay safe and healthy. Thank you, and God bless the people of Ontario. Now I'll hand it to Minister Elliott.
Thank you, Premier. This has undoubtedly been a year like no other, and the holiday season will need to be a little different in order to protect our loved ones and our communities. To support Ontario families as they begin to plan for the holidays, we are providing some initial guidance on how to safely celebrate this year based on the advice of medical officials. We do know how difficult the past few months have been for many people. And as much as we all want to spend time with family and friends, we must continue to do our part to stop the spread of COVID-19. That is why, as the Premier said, we are urging all Ontarians, no matter where you live, to only celebrate in person with the people you live with. If you live alone, join one other household to celebrate with. To connect with family, friends, and coworkers over the holidays, virtual celebrations are the safest option. Or consider exploring Ontario's great outdoors, where physical distancing can be maintained while you are hiking, building a snowman, or decorating the outside of your home with lights. This is the safest way to spend the holidays this year and to protect each other. Everyone has a part to play to stop the spread of this virus and to protect our loved ones and our community this holiday season. This includes making safe choices on how to celebrate. Wear a face covering when physical distancing is a challenge. Maintain 2 meters apart from others outside your household. Wash your hands often and stay home if you are not feeling well. We will also be launching a new website to provide more direct and up-to-date guidance to further support Ontarians as they plan for a safe holiday season. By continuing to follow public health advice, we can ensure a safe and healthy holiday season for everyone. We know it's hard. We know people miss hugging their loved ones. But with the recent news about the Pfizer and Moderna vaccines, there's light at the end of the tunnel. We're almost there. But now more than ever, it's important to follow the public health advice so that next year we can all be together for the holidays. Thank you.
Before I take questions, I need to address today's Auditor General's report. Folks, I welcome scrutiny. I've stood here and taken questions every single day. But the reality is that between the Minister of Health and the Minister of Long-Term Care, 2,744 work hours, I'm going to repeat that, 2,744 work hours, well over a year of work, was taken away from our efforts to fight COVID-19 to support the Auditor General in this report. And ultimately, I have some serious, serious problems with this report. To say that Dr. Williams wasn't leading this response, it just isn't right. It's actually wrong. This does nothing but undermine our entire health team. And I can't stand for this. And I'll tell you, I won't stand for this. My friends, ultimately, as your elected premier, the buck stops with me. But Dr. Williams has been riding shotgun with me from day one. There's no daylight, and I'm going to repeat this, no daylight between us. In every decision we have made, every step of the way, the health team, Dr. Williams, has guided us from day one. They have led us throughout this pandemic. For their help and support, I'm extremely, extremely grateful. They work around the clock, right around the clock, for 9 months straight without taking a single break. These are people who put everything they have into guiding us through an impossible situation, an unprecedented crisis. And we owe them a debt of gratitude. For the Auditor General to undermine them right now as they work morning, noon, and night to get us through the second wave, I have to question that. My friends, from the outset of this pandemic, we have moved at rapid speed. We have broken down silos. Our entire government has been working together. Every single ministry has been working together to tackle this pandemic. And the results speak for themselves. Ontario has the lowest rate of active COVID-19 cases among all provinces outside of Atlantic Canada. At 89 cases per 100,000 people. Compare that to other provinces. Ontario, 89 cases. Quebec, 128 cases. British Columbia, that was in this report. Ontario, 89 cases. British Columbia, 165 cases per 100,000. Ontario, 89 cases. Saskatchewan, 249 cases per 100,000. Alberta, Ontario, 89 cases. Alberta, 305 cases per 100,000. Or we see in Manitoba, 634 cases per 100,000 in Manitoba. In fact, outside of Atlantic Canada and the territories, Ontario has the lowest rate of active COVID-19 cases per 100,000 anywhere in North America. Not Canada, anywhere in North America. Well, no government is perfect. We can all be proud of our heroes, our doctors, starting with Dr. Williams and his team, our nurses, our frontline workers, everyone who has played a part in this. And I want to thank them. And I'll be happy to take questions right now.
We'll go to the phone line for questions. First question, please.
First question comes from Lucas Meyer at News Talk 1010. Please go ahead.
Thank you very much. Hi, Premier. What a day we have right now. Listen, you've got this situation at Adamson where people aren't following the rules and police are admitting mistakes in enforcement. Someone else says they're going to open up their gym in defiance. You've got a rally coming up at Queen's Park tomorrow. You have the Auditor General report acknowledging issues and specific criticisms of your government. You have CFIB on your case. Yep. We all know about the other public health officials that have criticized you. If you're losing people on all sides of the aisle here, if you feel that you're losing people and their support, how are you and the government going to get things back in order, especially with the holidays coming up? And why should people who are doubting the process trust you?
Well, they can trust us because of what I just said. We're doing something right, Lucas, when we're leading North America with the lowest active cases. You know, we have guided this province through turbulent storms with the support of Dr. Williams, his health team, Minister of Health, all ministries, working collaboratively with the federal and all 444 municipalities. I get it. People are getting edgy out there, and people want to open up their businesses. Well, I was nice to the guy yesterday. But buddy, let me tell you something. You need to shut down. You're putting people's lives in jeopardy. You know, I always try to be nice the first time, but this guy is just totally ignoring public health officials. You know, that's how this spreads. That's how we get out of hand, like the US states that are out of control right now. People are dying because of COVID-19. And he just wants to say, forget it, and have everyone down there. It's absolutely irresponsible and ridiculous. And then I find out he's doing so well online and takeout orders, he opened up a second location, but he wants to defy the guidelines from the chief medical officer. Unacceptable. Do you want to have cases like we see in the US or we see across Canada per capita? Some regions are over 6,000 cases, some are 10,000. You got to be kidding me. You see what's happening in Manitoba and across the other regions? We need to stick together. You want to get through this, we need to stick together. I'm not going to bend. I'm not going to start opening up all the businesses. That would be the most foolish, irresponsible decision anyone has ever made. We need people to pull together, not to go out there and just snub their nose at the regulations that we put forward. You want to see a serious crisis? It'd be a massive crisis if I stop listening to Dr. Williams, stop listening to the health table. We'd be in deep, deep trouble.
Follow up?
Premier, you said the buck stops with you, and you also, but also mentioning that you feel that this report undermines the public health process. There is a lot in there besides the comments about Dr. Williams. There's the issues around the asymptomatic testing, around the field staff, around not having an emergency management IT system. So in your view, after looking at this report, how much of it, like percentage-wise, do you feel is legitimate, fair criticism of you, and how much do you feel isn't?
Well, the Auditor General, let me just tell the people at home the Auditor General's role. The Auditor General is to go through the financial statements of all ministries and look for value for money. The Auditor General's job is not to be the chief medical officer, not to be the ombudsman, not to sit there and give us health advice, which I've always said there's a big problem with an accountant that starts giving me health advice or vice versa, or the doc's trying to give me economic advice. It doesn't work out well. So all I'm asking for the Auditor General, after 21 pages, I'm going to repeat this, 21 pages of inaccuracies throughout this report, for ever since day one, since I've been Premier, you've never, ever heard me criticize the Auditor General. Never. If there's financial issues, I'm here. I'll sit there and, I'll answer the questions day in, day out. But to sit in the office and throw hand grenades at Dr. Williams and his team and the Minister of Health is totally unacceptable. Totally unacceptable. Stick with looking for value for money. Stick with the job that we hired you for. Don't start pretending you're a doctor or a health professional, because I can tell you, you aren't. Stick with the numbers. Stick with the number crunching.
Next question.
Next question comes from Nicole Lampa at CTV Kitchener. Please go ahead.
Hi, Premier.
Hi, how you doing?
Just before this press conference, Waterloo Region's Medical Officer of Health issued a Section 22 for shopping malls and retail stores requiring owners and operators to actively monitor and manage capacity to ensure physical distancing is maintained. This is because Waterloo Region's cases and positivity rates continue to climb, and we just logged in moments ago our daily highest case count since the start of the pandemic. We are now in the red. Is there talks for Waterloo Region to enter a lockdown?
Yeah, I'll pass that to Dr. Williams. Thank you.
Well, thank you. And I think what you're addressing there is the uniqueness of Ontario, where we do have, unlike any other province in Canada, we have local public health, local medical officer health, their staff and team, combined with municipal officials, many who are elected sit on their Board of Health councils. When we have our regional ones doing issues, and they've asked me even today when I was talking to some about where do you think your place should lie with the numbers you're getting? And some asked to say, well, if we're in a yellow zone or an orange zone, but there's some things we really need to address up further, are we supposed to go ahead and put a Section 22? And I said, we've always encouraged you, if you see unique things in your area that you want to go beyond the ROA, that's expected of you. As a local medical officer of health in my area for many years, I never waited for Toronto to tell me to get my job done. I went ahead and did it. And you do those things. You make sure your board understands, you make sure the public understand, and you make sure you have the evidence to support that decision. And our medical officers do that. That's one of the strengths of Ontario's public health system. We have that in place. And I talked to a couple who said they're going to do that. And I said, excellent. Can you document that? Send it in so we can make sure we have consistency across the province. Because if I'm doing something in my area and you're in the same color zone next to me, they're going to ask, why is he doing it and I'm not doing it? And the coordination between them is very critical. They know that, they understand that, and we are doing that, and they've been excellent at coordinating throughout the whole process. So I applaud them for doing that, because that's their job, that's what's in legislation, that's the requirement of their position in their local area.
Follow up?
Does this mean, have you had talks about Waterloo Region entering a lockdown?
As of today, when we're reviewing the numbers, we had no one potentially entering a lockdown. So we didn't talk to anyone about a lockdown. I think they're all concerned, especially those that are in the red zone. Are they getting ready to move into that? And we had no health unit to consult at this stage that we saw was entering into the lockdown further. We'll have some further discussions with them. So no, we didn't have that discussion.
Next question.
Next question comes from Lorenda Redikoff at CBC. Please go ahead.
Hi, Lorenda.
Hi there. First question regarding the auditor's report. Premier Ford, how do you justify spending $1.6 million to get a consulting firm to tell you who to put on that COVID command table, on the various tables, pardon me?
I'll pass that to the Minister of Health.
Well, we knew we needed to act quickly, and we needed some with the knowledge and experience of how to put together a plan that would coordinate the response of the many ministries that had to be dealing with COVID-19. It wasn't just the Ministry of Health, it was Long-Term Care, Solicitor General, and the list goes on and on. So we wanted to make sure that we could respond in a coordinated whole-of-government approach, get us out of our respective silos, and so we needed to hire some with the expertise in order to do that, and that money, I believe, was well spent, because we have been able to have that coordinated response, and to make sure that that I know in Ministry of Health what's going on in the other ministries, because that will help determine some of the decisions that we need to make. So this was a firm that had experience in putting together plans in some of the U.S. states and other locations, and so that's why we went to this particular organization.
Follow up?
On to the plans for Christmas. Medical experts have been calling for you to take stronger measures in the weeks before you put the current ones in place. What do you say to responses that the advice for these holidays could have looked different for people had you acted faster? And if I can also squeeze one more in there, what are your recommendations for people for flying or traveling, particularly if they are isolating beforehand?
Well, first of all, you could always say, should have, could have, would have. Again, I listened to Dr. Williams and the health team, take guidance from them, and I'm happy that we made this decision because we have to lower the numbers. It's very simple. If I didn't do it, we got some people out there saying, keep the businesses open. You have other people saying you need to close them down. We're trying to do a happy balance. We have to keep the economy moving and protect the health and well-being of every single person in this province. And that's the number one priority. Health is number one priority. Without the health, we have no economy. All of a sudden, you start filling up the hospitals, the ICU units. You have backlogs of surgeries not getting done as you fill up the hospitals. We have to stop the spread. It's very simple.
Next question.
Next question comes from Robert Benzie at the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. I wanted to ask you about a story that's on our front page this morning about this alleged $11 million fraud of provincial funds that were designed to go to families, mostly with kids with special needs. It looks like the police are investigating. The government is contending that $11 million was stolen. I'm just wondering for your thoughts on that, and how could this happen? Are you not doing enough oversight?
Yeah. Well, first of all, my hands are tied. It's in front of the courts, but what I can tell you, it's totally unacceptable what's happened, and I'm sure they'll face the consequences. It's unacceptable. I wish I could go full steam on this one, but I can't. It's in front of the courts. My hands are tied on this one. Ask me after the decision has been made, and I'll open up on this guy like I've never seen.
Follow up?
But I mean, hundreds of millions of dollars in provincial money is going out the door. Are you satisfied, not speaking about this specific case, because clearly it's before the courts and you can't, I guess, comment on it, but can you assure taxpayers that their money isn't being stolen or wasted or squandered, given that this kind of theft allegedly happened? There's hundreds of millions of other dollars going out there. Where is it going, and is there enough oversight?
I believe there's enough oversight, and I wish I could get into more details about what happened to the other situation, but I can't. But I do feel like there's oversight. We're pushing the system. I can tell you, there's no government that has pushed the system harder than what I have, my Minister of Health has, Dr. Williams. Everyone is pushing the system. It's not business as usual. To the point, we're changing the whole procurement program, and we're going to save $1 billion to $2 billion for the taxpayers. I've seen, Robert, since this pandemic, I've seen the cracks in the ship left by the previous government, and we're fixing it. No matter if it's long-term care, if it's procurement of the PPEs and the procurement system that I mentioned the other day of 7,000 procurement officers in Ontario, that's unacceptable. So not only are we're working on the COVID response, we're working on fixing the system and respecting the taxpayers' money and coming out of this with a better system than we've ever had on all fronts, no matter if it's a healthcare front or the justice system or any other area, education. We have a better system than we had before the broken system that we inherited, bar none. It's not even comparable.
Last question.
Last question comes from Jeff Gray at the Globe and Mail. Please go ahead.
Hi, Jeff.
Oh, hi. Thanks. Ms. Premier, I wanted to ask you about some of the language in that Auditor General's report, which you've already addressed a bit, but, confused, disorganized, talks about the tables. There's tables upon tables. I can't keep the tables straight. I defy anyone to keep the tables straight. There are, in fact, the report says people who thought they were on tables, and it turned out they weren't, in fact, on these tables. And the Auditor General goes through a number of decisions that were either delayed or where a decision that was contrary to expert advice ended up being made. Is there not some reforms, some cleanup, a reorg that you would consider that command structure, which just seems on the face of it to be so unwieldy.
Yeah, so what I'm going to do is I'm going to first pass it to the Minister of Health, then over to Dr. Williams. But I'm really glad the Auditor General just got a health degree and become a doctor over the last year or so. So I'll pass it over.
Well, the health command table was set up very early, as is required during a pandemic or a situation such as we faced. And the health command table did have health experts on it. It was with Dr. Williams as an active participant, with the Public Health Ontario, with the Public Health Measures table, and many other people who were providing advice to us, and ultimately to Dr. Williams, who then provided the recommendations of the entire group to us for consideration and ultimately action. There were many people on the calls, as the Auditor General noted. However, they were not all participants. Many of them were on the calls to listen and to understand what recommendations were being made. Some of them were medical officers of health locally. Some of them were actually on the table. But it was really important to have a coordinated response that many people knew what was happening. And so there were many public health experts at that table, and they did discuss and decide on many issues, and ultimately that was brought forward either by the Public Health Measures table with Dr. Williams or by Dr. Williams alone. And that is the evidence and the data and the recommendations that we relied upon in making the many difficult decisions we've had to make in Ontario. And with that, I'll turn it over to Dr. Williams.
Well, thank you. And I think what you're asking is the challenge when you're dealing with a pandemic plan and how it's carried forward, especially in the province the size of Ontario. And in our plan, it's very clear that we started off, although it wasn't noted in the report, because we went through this with SARS. I was there. We went through it with H1N1. And we start with activating our Emergency Operations Center. We did that in the second and third week of January. We started having our stakeholder calls, because one of the things we learned from those other ones, don't keep sending us piles of paper and documents that get more and more confusing. Regular teleconferences, talk to us, let us ask our questions, give us the data, give us the information, give us the situation reports. We want to be kept informed because we have to do our own planning in our own jurisdictions. And we did that. And we continue to send out lots of reports and data. And we try to keep the formal documents clean, as tidy as possible, so we didn't confuse the field. We had learned that in the past, and we didn't do that. When in our plan, if it affects more than just people showing up at a few places for testing, as in travelers, it becomes an issue related to where the hospital healthcare system is starting to be compromised, you form the command table. It's very clear. And the command table is chaired by the minister or her delegate, in this case, the deputy. That's the way it's laid out. And you expand, because it may be one or two hospitals, maybe just the emergency departments, it may be just some other areas. We found very quickly this spread was working, impacting hospitals, emergency departments, congregate settings areas, community health centers, long-term care facilities, retirement homes, and you have to keep adding groups to do that. Why? Because it's a big province, and you have to have all those in place, because you can't wait until it all filters through one desk. That would be inappropriate. And so we formed all these different tables. People have a job, if they're at a table and they don't have the information, they need to not wait for someone to tell them, they need to ask and saying, I was not clear, I need to know, and ask those questions. Why? Because we've got a lot of great people in Ontario. We have great systems to handle, and we have to do that because we have a huge province, we have a wide and varied province, and it didn't happen like in SARS, just in Toronto. It happened throughout the whole province, in urban, dense urban, suburban, rural, and remote. And just as important, our First Nation communities. We have one of the most number in Ontario. Everyone is important. You have to deal with them all and keep it all on the table. And therefore, you have to have different inputs and different parts to make sure everybody is kept informed and understand what their duties and responsibilities are. And if it's not, we need to know, because then we can inform you and answer all your questions. That's how it works, and that's how we have to continue working, because we're not out of it yet, and we'll continue to drive forward. And I really appreciate all the work of all the different people at the tables, and we're talking a lot, and they devoted hours and hours of their own time asking, looking, analyzing, and giving direct advice and clarity to the matters. That's how it works in Ontario, and I really appreciated all the work of our local health units, of our people in Ontario Health, of our health table, of our deputy minister, of all the ADMs. They all took part. and of our government-wide systems, because it affected all parts of government. And this is a big job, never before faced by our province, and I really appreciate all the input, and especially the ongoing leadership and receptiveness of the Minister of Health, Deputy Minister, Deputy Premier, Vice Premier, and the Premier, who not only I find my advice is easily and readily accepted, they're asking for it. And so I try to make sure it's as clear as possible all the time throughout, and we have to just continue doing that and keep things moving. So thank you for everything's done, and we just ask everybody, stay at the task. We're not there yet. There's a light at the end of the tunnel. We got a lot of big jobs ahead of us, but it looks like we're moving things in the right direction all the time.
Follow up?
Just to follow up then, you've mentioned your confidence in Dr. Williams. Minister Elliott, I think, stated today on this issue of whether the advice that Dr. Williams, the Public Health Measures Table, and Public Health Ontario make should be made public before it goes to Cabinet, so the public can see what advice is being followed and what advice isn't. Minister Elliott suggested that was the case. We know that's not the case because Dr. Williams has said that multiple times, that he's not able to release that advice. It's a recommendation of the Auditor General. It's a recommendation in the SARS Commission. Will you commit now to allowing the advice that the Public Health Measures Table and Dr. Williams and Public Health Ontario make in a health emergency public, so that the public can evaluate and we take you at your word, but the public could actually see firsthand what advice you're following?
Well, I appreciate that, and I'll bring that back to Cabinet, and I'll have an answer over the next few days. Again, I'm up here every single day being transparent with the public, and there's information out there all over the place on what we're doing, where we're going, what our plans are. There is no secret here. I've been transparent with the people, but I've been honest with the people. What I know, I come out here the next day, or at the latest 2 days later, and get in front of the camera and answer the questions to the best of my ability. And I appreciate the support from the Minister of Health and Dr. Williams and the whole team from day one. And we're going to continue focusing on getting this province back on their feet economically. And when we do, we will have the economy booming. As sure as I'm standing here and there is light at the end of the tunnel with the vaccine coming forward. And this is very simple. This is about either showing leadership, Dr. Williams, myself, the minister, the whole team, or just sloughing it off and not worrying about things and letting things go hog wild like we're seeing, again, in the U.S., for example. It's out of control. It's easy for when I saw some news, the governor saying, we're opening everything up. Yeah, there's thousands of deaths in the state when they open it up. And I know people do not want that to happen. They want to make sure their family's safe, especially during the holiday seasons. They want their elderly grandparents, they want their mothers and fathers safe, and they want their kids safe. And I'll tell you, Dr. Williams, the Minister of Health, they've done a spectacular job. Numbers don't lie. Look around the world what's happening. You know something? We have a long ways to go, but we're doing pretty good. So thank you, everyone.
Thanks, everyone.